Have you ever wondered how holding your urine for extended periods might affect your body, especially as you age? For individuals over 50, the risks associated with delaying bathroom breaks can be more significant than you might think. While it may seem convenient to postpone emptying your bladder during a busy day or while traveling, this habit can lead to serious health complications. So, what exactly happens when you hold your urine too long, and why is it particularly concerning for older adults? To understand the risks, let's first explore how the bladder functions. The bladder is a muscular organ that stores urine until it's time to release it. When your bladder fills up, nerve signals alert your brain that it's time to urinate. For most people, this process works seamlessly. However, ignoring these signals and holding your urine disrupts the natural rhythm of bladder function. As we age, our bladder capacity naturally decreases and its muscles weaken. This means that after 50, the ability to hold it becomes less efficient, making prolonged delays even riskier. But beyond inconvenience, there are specific dangers associated with consistently holding urine for too long. 1. Weakened pelvic floor muscles. The pelvic floor muscles play a crucial role in controlling urination. Holding urine frequently forces these muscles to work overtime, eventually weakening them. Weak pelvic floor muscles contribute to issues like urinary incontinence, leakage, and overactive bladder syndrome, conditions that become more prevalent with age. 2. Bladder damage. Prolonged urine retention can stretch the bladder beyond its normal capacity, causing permanent damage. A damaged bladder may struggle to contract properly, leading to chronic urinary retention. This condition requires medical intervention, such as catheterization, to ensure proper drainage. 3. Kidney problems. Your kidneys filter waste products from your blood and excrete them as urine. If the bladder isn't emptied regularly, urine can back up into the ureters, the tubes connecting the kidneys to the bladder, and potentially reach the kidneys themselves. This backup increases the risk of kidney infections, stones, and even long-term kidney damage. 4. Increased risk of bladder cancer. While rare, chronic irritation of the bladder lining due to prolonged urine retention has been linked to an increased risk of bladder cancer. Although other factors like smoking and exposure to certain chemicals are bigger contributors, avoiding unnecessary strain on your bladder is still essential for reducing overall risk. For these reasons, adopting healthy habits around bladder care becomes increasingly important as you get older. Fortunately, there are simple steps you can take to protect your bladder and minimize the risks associated with holding urine. 1. Listen to your body. Pay attention to your body's signals and respond promptly when you feel the urge to urinate. Ignoring these cues repeatedly trains your bladder to tolerate larger volumes, increasing the risk of complications. 2. Stay hydrated. Drinking enough water ensures that your urine remains diluted, reducing irritation to the bladder lining. Aim for about 6 to 8 glasses of water per day unless advised otherwise by your doctor. 3. Practice Kegel exercises. Strengthening your pelvic floor muscles through Kegel exercises can improve bladder control and reduce the risk of incontinence. Simply tighten the muscles you'd use to stop urinating midstream, hold for a few seconds, then release. Repeat 10 to 15 times daily. Schedule bathroom breaks. If you find yourself frequently forgetting to use the restroom, set reminders on your phone or watch to take regular breaks. This practice helps establish a routine and prevents accidental delays. 5. Avoid irritants. Certain foods and beverages such as caffeine, alcohol, spicy foods, and artificial sweeteners can irritate the bladder. Limiting these triggers can promote better bladder health. 6. Seek medical advice. If you experience persistent symptoms like difficulty urinating, frequent UTIs, or leakage, consult your healthcare provider. Early intervention can prevent minor issues from escalating into major problems. Ultimately, the best way to avoid the risks of holding urine for too long is to prioritize bladder health as part of your overall wellness strategy. For those over 50, this means being proactive about recognizing the signs of bladder distress and addressing them promptly. So, what happens when you hold your urine for too long after 50? The answer is clear. It places unnecessary stress on your bladder, increases the risk of infections, and can lead to long-term complications like kidney damage and incontinence. While occasional delays may not cause harm, making a habit of ignoring your body's signals can have serious consequences. Take charge of your bladder health today by listening to your body, staying hydrated, and practicing good habits. If you found this video insightful, don't forget to give it a thumbs up and share it with someone who might benefit from this information. And for more tips, resources, and content on staying healthy, be sure to subscribe to Health Assets, your go-to channel for everything health-related. Together, let's build healthier habits and a brighter future. Thanks for watching.